A very good afternoon to all. I'm Dr. Uthra Mohan from IIP Digital Media team. I'll be host for this webinar today. The topic of the webinar is a glimpse into face physiotherapy. The resource person for today is Dr. Garima Gedamkar. This webinar is being organized by IIP Women's Cell Delhi State. We are live on IIP India YouTube channel for this webinar. I request all to subscribe to this channel to get regular notification during our live webinars. I'll also share the links of social media in the chat. IIP has its profile on social media platforms such as Facebook, Instagram, Twitter, LinkedIn as well, along with YouTube. You can follow updates for upcoming events by IIP on these platforms. We have various events such as webinars, workshops, CMEs, conference, health camps, etc. And we also share recent updates about our profession. In YouTube channel, in playlist section, the webinars are segregated into folders of various topics for easy referrals. Okay. Now I request Dr. Vidu to please take over.
Thank you, ma'am. Good afternoon, everyone. I'm Dr. Vidhu, today's moderator. We have Dr. Garima Gedamkar today with us. Dr. Garima is an accomplished and multidisciplinary professional with expertise spanning neurorehabilitation, stroke therapy, and space exploration. As the founder of Astrosize, she has pioneered innovative approaches to neurorehabilitation, integrating these space technologies and methods to enhance the recovery for individuals with neurological conditions. With over a decade of experience as a specialist neurorehab and stroke ESD physiotherapist in the NHS UK, Dr. Garima has made a significant impact on patient care, utilizing cutting edge therapies to improve the functional recovery. Her commitment towards the advancing scientific knowledge extends beyond the healthcare into the realm of the space science. As a space station ambassador for the International Space Station National Laboratory, Dr. Garima actively contributes to the research initiative focused on the intersection of the space technology and human health. She is also a mentor for the Space for Women, a UN initiative that empowers the women in the space sector. Dr. Garima has a passion towards the education and the space exploration is evident in her previous role as a teaching associate at the International Space University, where she engaged on the students and professionals, sharing her knowledge of space and its application on Earth. Her unique combination of skills in healthcare and space science makes her trailblazer in the both fields, driving forward the integration of innovative technologies for human health and well-being. So today we are celebrating the National Space Day with Dr. Garima. So over to Dr. Garima, please.
Thank you so much for the generous introduction.
Thank you,
I
ma'am.
wish you all a very happy National Space Day.
Thank you so much. Same to you.
Thank you. Should I start sharing my screen and begin the session or?
Yes, ma'am.
If you can confirm that my slides is visible.
Yes, ma'am, it's visible.
So, good afternoon, everyone. It's truly an honor to be here. Today, we are going to step into the unique and challenging world of space physiotherapy, exploring how the absence of gravity shapes human physiology and how a physiotherapist or we as a healthcare professionals can contribute to optimize astronaut performance in space. So first of all, the learning outcomes that gives you an impression what I am going to talk today about is, so at the conclusion of this session, I trust you will leave with an overview of the following key concepts. The first is the space physiology, that is how the human body responds to unique environment of microgravity, with particular attention to musculoskeletal, cardiovascular, and neurosensory systems. Now, these systems are so finely tuned on Earth that they go remarkable changes in space. And following which, I will highlight the indispensable role of physiotherapy in optimizing human performance in such an extreme environment that helps the astronauts not only to survive, but also to thrive in space. Initially, when I'll be talking about space physiology, I may use the term like 1G or micro G. So 1G would be standing for Earth's gravity, and micro G would be the space environment or the weightlessness. So to begin our session with, I would first like to ask you all a question. Who is an astronaut? If we can have the word cloud for the participants, please. I just want all the participants to write maximum in 3 words according to them what they feel an astronaut is. It could be their roles, their characteristics, their skills, whatever first comes to your mind when somebody talks about an astronaut. I think 30 seconds should be all right for this question to be answered. Can we have the answers on the screen? It's ended.
Two people have answered. I request others also to post their answers.
If we can see what they have written, it would be helpful. Ma'am, please can you share the result?
Yeah, I think since your screen share is going on, the
Yeah. Do
result
you
is
want
not
me to
getting
stop?
shared.
Yeah. Do you want me to stop
Yeah, I
sharing the
think
screen?
yes.
Ma'am, stopped sharing the screen.
Is it visible now? Okay, I've put it in the chat for you, Dr. Garima.
Yeah, I can just check that. travel, those who travel in a spacecraft, someone who travels to this space. Trained to work in spacecraft, explorers of unknown, human representatives in space. Really good answers. Yes, so I will quickly share my screen and we can again start. Going ahead. So yes, I mean, amazing answers, I can say. Why I have asked this question is because this is the population about which we are going to learn today. And that's why it is very important to understand who that population is. So who is an astronaut? Astronaut is a product of science working in the field of space aviation, wherein he or she gets an opportunity to perform scientific experiments in space. Now, purposely, I have included this slide to highlight the critical role of physical fitness. As you can see alongside, there are many characteristics written around the photographs, but the most important, what I would like to highlight an astronaut must have would be physical fitness. Now, the challenges astronauts face due to the effects of microgravity, it makes fitness and physiotherapy both an essential component of their training as well as a part of their rehabilitation. So I'm aiming to emphasize how rigorous fitness regimes are integral, not only in preparing astronauts for launch, but also in ensuring that their health and well-being during the entire duration of space mission is maintained. All right. Now coming to the verticals in astronaut training. Now, if you break down the verticals, there are totally 6 key components. And again, if you see, physical fitness is one of them. So astronaut training is actually multidimensional and it involves various specialized areas. Each of them plays a significant role ensuring that the space mission is successful, but physical fitness and rehab is one of them. So today, first, I'll be talking about space physiology. Space is a microgravity environment, which means some mechanical forces on the body that we are used to on Earth, they are either absent or reduced in space, resulting in two changes in various systems of the body. Yeah, so we are only going to cover the musculoskeletal system, the cardiovascular system, and the neurosensory system in today's session. So here comes the first system, the musculoskeletal system that comprises of muscles and the bones. Coming to bones, so bones and muscles, they are formed on Earth as a result of first, the life in the 1G environment of the Earth, and second, the mechanical forces which are exerted on the body. Here in the picture, the darkened bones, as you can see, they are the major bones that are primarily involved in counteracting the acceleration of the gravity. That is, they are the lumbar vertebrae, the pelvic girdle, femur, tibia, and the calcaneus. Now let's see what happens to the bones. Now in 1G environment, the bones are stressed by the gravity. Therefore, the bone breakdown and the bone formation, this equals, and hence there is no bone loss in an apparently healthy individual. Whereas in microgravity environment, there is no gravitational stress on bones. So what happens there is the bone breakdown continues, but the bone formation reduces, and this results in bone loss in astronauts. Coming to the muscles, so the major muscles counteracting the gravity are the anti-gravity muscles. And on Earth, again, the muscles are similar to bones. They are stressed by gravity. So the protein breakdown and the protein synthesis, it equals, resulting into no muscle atrophy or no muscle loss in an apparently healthy individual on Earth. Whereas In microgravity, there's no stress, so the protein breakdown continues, but the synthesis reduces, and this results into muscle atrophy in astronauts. So it is well documented that because of the absence of gravity strains on the body, astronauts can lose up to 1.5 to 2% of their bone mineral density per month. And coming to the muscles, as you can see here in the picture, 11% loss in the back muscles, 12% in the thigh, and 20% in the calf. So overall, again, 2% loss in the muscle of an astronaut. So all this changes in the bones and the muscles, they result in osteoporosis in an astronaut, and that's why astronauts are sometimes referred as hypersedentary person. It results in injuries or back pain or different strains or dislocations in them. There is reduction in muscle strength, reduction in muscle endurance, increasing fatigability. So all this makes them more susceptible to have an injury. Yeah, so that was about the musculoskeletal system. The next is the cardiovascular system. The cardiovascular system comprises of the systemic circulation and the pulmonary circulation. Yeah, they are the two basic components of the cardiovascular system. Now, what happens is that the deoxygenated blood from the brain, upper body, and the lower body, it is carried towards the heart, and oxygenated blood is carried away from the heart. On Earth, the calf muscles actually helps the lower body to push the blood against the gravity and pushing it towards the heart. One more thing about the cardiovascular system on Earth that I would like to discuss is about the initial effect of standing on circulation. So when an individual stands, the blood starts to pool into legs or into the lower body because of gravity. So if that continues to happen, so venous return to the heart would be reduced. This will result in reduction in blood pressure and blood flow to the brain. And if it continues, then there could be a lack of oxygen to the brain, resulting into dizziness, impaired consciousness, or impaired vision. But this does not happen normally with us on Earth. Why? It is because of the rapid nervous reflex compensatory responses that happens in the body during standing. So what happens is, like I mentioned, the role of calf muscles. So they helps and they're to pump the blood towards the heart. Now, as we stand, there would be increase in heart rate to partially restore the blood pressure, venous constriction, that's just now I've spoken about it, which will help to fully restore the blood pressure, and constriction of the vein that may assist in venous return as well. All these helps to restore the venous return as well as the blood pressure, and that's how the blood flow is restored in the upper part of the body, or mainly if I say to the brain, and there is no abnormal symptoms that those are observed in an apparently healthy individual. So if I may ask the participants, the picture or the image on the right is of a Chinese astronaut. Does anyone know her name? If it is, you can just type in the chat. And why she is so special for Chinese Space Agency is because she is the first Chinese astronaut female to walk in space. Also, I would like you all to pay attention to 1G and the micro G photo, and if you can identify any changes in her. Has there been any answers in the chat box? Correct. We'll talk about it if you have answered it in the chat box. And I'll play this video. It shows the circulation on Earth and in microgravity environment. So we have just spoken about the systemic circulation or the cardiovascular circulation and the pulmonary systemic and the pulmonary circuit, how it helps. What I would like to also emphasize is that there is also around 1.5 liters of fluid in the lower part of the human body, which is outside the circulatory system. And what is interesting to know here is that gravity keeps it there. So when astronauts enter microgravity, this fluid floats into chest and head, resulting into a syndrome. We call it as puffy face and chicken legs. And that's why I said, if you can pay attention to the photo here, you can clearly see her face is a little bit bigger than that of on the Earth. Yes, and the other changes, what we can see in the cardiovascular system would be reduced circulatory blood volume over a period of time, reduced heart size, reduced aerobic capacity, and post-flight orthostatic intolerance. All these changes happens over a period of time, and it continues until the astronauts are in space, right? And here comes the last system that we are going to discuss about is the neurosensory system. The neurosensory system comprises of the visual system, somatosensory system, and the vestibular system. Visual system, it includes the eyes, the connecting pathways, that is through the visual cortex, which is required for the visual perception, like receiving, processing, and interpreting the visual information to build a representation of the visual environment. The somatosensory system, it is the part of the sensory system which is concerned with the perception of touch, pressure, pain, temperature, position, movement, vibration, all of them arising from the muscle, joint, skin, and fascia. And coming to the vestibular system, it comprises of semicircular canals and the 2 otolith organs. The vestibular system's main purpose is to create a stable platform for the eyes so that we can orient ourselves to the vertical. That means standing on Earth or sitting on Earth, we can say up is up and down is down, and we can move smoothly. Now, both, there are 2 different, like I said, the semicircular canals and the otolith organs. So let's talk a little bit about them more. So if we talk about gravity, there are 2 components of that. One would be the linear acceleration, and other thing would be the angular acceleration. The linear acceleration sensing system, it sends message to the brain how the head is translated or how the head is positioned relative to the force of gravity. Okay, and it contains 2 tiny sacs filled with fluid, the saccule and the atricle, which is lined along the inner surface with the hairs of various length. Then the second is the angular acceleration sensing system, that is the semicircular canals. The system detects angular acceleration through the inertial movement of the endolymph, which is the liquid in the canals. Yeah, and it sends the input to the brain about the rotation of the head. So there are 2 movements. One is the head tilt and another one is the rotation that is being sent by the vestibular system. So all these 3 systems, what we have talked about, they send input to the central nervous system where complex interaction takes place and it results into appropriate body posture and movements. When I talked about the vestibular system, I would like you to pay attention here to the otolith organs. Now, on Earth, when the head is not tilted, they are not stimulated. If you can see in here, they are upright. When the head is tilted, because of the gravity, these otolith organs are stimulated. Yeah, they bend down, and that's where they send the input to the brain about the head tilt. The second thing is your vestibulo-ocular reflex, which is the gaze stabilizing reflex. Now, what happens is the sensory signals encoding the head movements, they are transformed into motor commands, which will generate compensatory eye movements to the direction opposite to that of the head movement. Now, this ensures a stable vision. So along with what we have seen for the visual system, the vestibular system, and the somatosensory system, I just wanted to highlight these two components. Now, coming to the microgravity environment, what happens to these systems? So we have discussed regarding the fluid shift during the cardiovascular system. Now, this fluid shift causes pressure along the optic nerve, and which results into optic nerve compression. There would be flattening of the eyeball and may also result in optic disc swelling. And this results into visual impairment in astronauts. Coming to the somatosensory system. Now, astronauts, they are always floating in space and using their upper limbs for moving around. So what happens is there is either little to no input from the lower limbs when they are moving around, and this results into degradation of the proprioceptive functions in the lower limbs and inaccurate external spatial map. Now, third comes is our vestibular system. I've just discussed regarding the vestibular system, what happens on Earth. Now, let's pay attention here. What happens to the otolith organs in space? So in space, when the head is tilted, the joints and the muscles, they send an input to the brain that yes, the head is tilted. If eyes are open, vision says, yes, the head is tilted. But since there is no gravity to stimulate these otolith organs, they send an input that no, that the head is not tilted. So what happens is now our brain starts to receive mixed input from different parts of the body, or the different inputs which are integral for it to make a judgment. And that's where the problem starts. So this results into impaired balance, impaired posture, difficulty in walking or standing once the astronaut comes back from their mission on Earth. Now, because the stimulation from gravity is absent in weightlessness, interpretation of otolith signals as tilt is inappropriate in space. And therefore, one of the theories says during the adaptation to the microgravity environment, the central nervous system, it reinterprets all the otolith signals to indicate translation. So there is no tilt which is being perceived by the vestibular system. So the brain also learns to reinterpret all the tilts as a translation. And this hypothesis is also known as OTTR, that is otolith tilt translation reinterpretation. Long duration flights, what happens is there's something called as space flight associated neuroocular syndrome. This is a medical condition in which there would be combination of symptoms seen like blurred vision, optic disc edema, glow flattening, refractive changes. All these are affecting the vision. So the neurosensory system, as I said, the alteration results into space motion sickness. Most of the astronauts experience this, within hours when they reach the space. Then there is altered postural control, altered balance or disequilibrium, gait instabilities, altered eye-hand coordination once they come back on Earth. So what does that mean? This means the microgravity environment is resulting into degrading all the systems what we have just discussed. But what I would say here is the profound multi-system changes that takes place in human body in microgravity environment is because of the adaptation. And this adaptation is frequently called as deconditioning because the changes that occurs, that they are unfavorable for life on Earth's gravitational environment. So in general, the physiological adaptations to weightlessness, they are not significant problem as long as the astronauts remains in space because they are adapting to the new environment to live there. But the problem arises when the astronauts returns back to Earth's gravity. And that's where a medical crew is required to ensure that they are at their best health. And physiotherapist is an integral part of that medical crew or multidisciplinary team looking after astronaut health. So let's start with the space physiotherapy module for today. There are 3 mission phases, which is important for us to know because physio is involved in all 3 mission phases. The first mission phase is called as the pre-flight phase, in which is the duration where a mission is been assigned and they are being trained to go to space. In flight is their entire duration of stay in space, and post-flight once they return back on Earth. Now, pre-flight, a detailed examination of each astronaut is completed, which comprises of body composition, flexibility, muscle strength, including the hand grip strength, muscle power, balance, aerobic capacity, the core strength, and all this data is matched with the standard criteria of the particular space agency. And based on that, exercise protocol is customized for each astronaut using the FIT principle. Now, coming to the pre-flight training. The pre-flight training usually begins with mission assignment between 1 to 2 years prior to the launch, and the exercise program, it consists of mixed of supervised and unsupervised exercise session. The supervised sessions consist of typical gym exercises as seen in this video, but the specific focus is on development and implementation of individualized International Space Station in-flight exercise protocol. So what happens is, it's not always possible that they attend the same gym because they have the other components of their astronaut training. So on a regular basis, if the astronauts are not coming to our setup, they are requested to provide their training data, including the type of exercises done, the training time, the intensity, the heart rate, and their personal feedback as well. Now, these data, in conjunction with the results from the standardized pre-flight test that was done, they are used by physio or the exercise specialist to individually tailor the in-flight exercise countermeasure training programs for them. Now, this period is also crucial for building trusting relationship between us and also to maximize the compliance. As you can see here in the video, it's doing the stretching exercises, the strengthening exercises. There would be aerobic training on treadmill or cycle ergometer, and especially the Indian astronauts or the Gaganyatris, they practice yoga as well, where Mr. Rakesh Sharma, who is also known as Antariksh Yogi, was the first human to practice yoga in space. There are other exercises, as you can see in the pictures, underwater exercises are being done. Then they are exposed to the hypobaric chamber, to experience and also to identify what hypoxia is. Anti-gravity treadmill training, the VR training is being done. But an important part of the pre-flight training is the training with the replica, which is a station-specific flight-like countermeasure device, because we do not have a gym setup on International Space Station. You can see this in this video. This equipment is called as the Advanced Resistive Exercise Device. This is into the NASA module of the International Space Station. This equipment is slightly different than the squat rack in the local gym, but has similar functions, like astronauts can do squats, deadlifts, bench press, shoulder press, and other exercises. So it has two canisters which has vacuum in them so that the astronauts pull against the vacuum, and they have to adjust the bar depending upon like how he's doing it now, depending upon which exercise is required to be done. Once the bar height is adjusted, they lock it, and once the setup is done, after adjusting all the adjustments, they will be standing on a yellow platform to perform the exercises. Now, the black platform is not there on board. It's only the yellow platform which is available on board. So they stand on that yellow platform and do the exercises. Now, the goals of pre-flight training program is to prepare the astronauts for space, to conduct the pre-flight measures, to familiarize themselves with the in-flight training program and the equipment with correct techniques, and to treat any pre-existing conditions if they are suffering from. So that was about the pre-flight training. First part would be the assessment, and next would be the exercises. So here comes our next question. Once the pre-flight training is completed, then the astronauts are quarantined, which is also called as the health stabilization period. So I would like you all to answer what you feel. How long are astronauts quarantined before flying to space? And I'll stop. So your options are 5 days, 7 days, 10 days, or 14 days minimum. All right. So 25% says 7 days, 25% said 10 days, 50% said 14 days. Nice. Yeah, so the correct answer is 14 days minimum of health stabilization period. But if the launch gets delayed, then the quarantine continues until they fly to space. Thank you so much for that. All right. So next comes, once they are in space, then the in-flight exercise countermeasures. Now, once they reach to space, the exercises are divided into 3 phases. Phase 1 is the adaptation phase, in which the crew familiarize themselves with the ISS hardware and also adapt to the new environment of microgravity. But then again, I said, once they start adapting it, and then the exercises are started in phase 1 as well. Then next comes is the main phase, that is phase 2, in which the exercises are done to prevent the microgravity effects. And then phase 3 is preparation for re-entry, final 15 to 30 days for long duration missions, where we prepare the crew member for rigorous re-entry and potential of nominal landing scenarios. So here the goals are to maintain good health conditions and high work capacity of the crew members, to mitigate the effects of microgravity, to save coordination abilities, allowing them to maintain a vertical position, either to walk or run in case of emergency when they are landing back. Right. So on board, now we'll be seeing the different hardwares or the exercise equipment which are present. In the NASA module, there are 3 equipments which are available to the astronauts for exercises. The first one is called as the CVIS, that is Cycle Ergometer Vibration, Isolation and Stabilization. It is like an exercise bike in which they wear the harness and tether themselves to the bike so that they don't float away. what happens is they have a data card in which all the information is stored, and they use this data card to know what is expected from them in a particular session. For example, if I have to say, um, like CVS protocols, they are based on a pre-flight VO2 max, the graded cycle ergometer test. So if you talk about Canadian Space Agency astronaut, they would use a steady state protocol approximately at say 80% of pre-flight VO2 max when they are exercising on it. The second one is the Colbert, which is the combined operational load-bearing external resistance treadmill. Now, this is a treadmill where again they use the harness as well as a cord, a bungee cord that keeps them on the treadmill, as well as to vary the load which is expected for a particular training session or exercise session. Now, this treadmill is used in both motorized and non-motorized mode, and it can speed up to 20.4 kilometer per hour. The treadmill protocol, similarly, as that of the CVIS, the intensity is increased throughout the mission by modifying either the running speed or the interval duration. And finally is the ARED that we have seen in the pre-flight phase. This is the advanced resistive exercise device, which provides load from 2.2 kilograms to 272 kilograms. So a wide range has been covered by this particular piece of equipment. Right. And finally, once they come back, the post-flight phase begins. The post-flight phase, like the pre-flight, mainly is assessment and the rehab. It is divided into 3 phases. The first phase is back to gravity, where we give time to the astronaut to readjust themselves to gravity, usually 1 to 2 days. Then up to 10 to 12 days, it would be back to function. And then last remaining days would be back to work. Now here the goals are to prevent short-term and long-term painful conditions developing, addressing any mission-induced physical health problems, returning astronauts to their pre-flight conditions, and preventing long-term effects. Now, as you can see here, once the astronauts lands, they are taken to the medical tent where the assessments begin. You can clearly see the astronauts, they are struggling to stand, walk, balance, and this examination continues throughout the 45 days. Now, after 6 hours, you can see it's much more stable, and after 22 hours, very, very better than immediate landing. So there are different test batteries which are being developed by different space agencies that are used to evaluate a particular astronaut. Now, the test batteries which I was talking about is, for example, one of them is the functional task test, which is developed by the NASA. It is an interdisciplinary testing regime, which is developed to evaluate the astronaut post-flight function performance, which is related to the physiological changes in them. And now coming to the post-flight rehab. So during the daily 2-hour session, the first hour is dedicated to physiotherapy, and they address any specific conditions if they are suffering from. The first week, exercises would be performed in swimming pool in coordination with the gym sessions. Why swimming pool? Because the feeling of neutral buoyancy in water is perceived very comfortable by the astronauts, and it reminds them of being absence of body weight in microgravity. Because once the astronaut comes back, it's almost 1/3 of their body weight is added, so they really feel the body weight during any of the movement in 1G environment. Now, as the crew member progresses, the gym time versus the pool time is increased, and physiotherapy performing. What happens in the main phase of the reconditioning program is more of the balance training, resistance exercises, they are being conducted. Initially, the program will focus on basic ambulation, the cardiovascular endurance, strength, balance, flexibility, proprioception. And as it advances, it would be more on active conditioning by adding higher intensity aerobic exercises, strength training, power type exercises like jumping and medicine ball exercises, and concurrently more and more complex movements for balance, agility, coordination training, they are progressively added according to the astronaut's tolerance. So between day one of their return up to 21 days, the intensity level is progressively increased without evoking any strong physical effects. And after 21 days, the training program would be similar to that of their pre-flight training routine. And this post-flight reconditioning program, it continues, like we say, for a long duration flight, it is 45 days of rehab. A short duration flight, it could be few weeks, just say 2 to 3 weeks, and they would be back pre-flight. But sometimes some astronauts takes longer time. So until they regain the pre-flight fitness level, it continues. But after that, we call it as a third phase. The astronauts, they are released from the formal training or rehab, and they are encouraged to participate in a maintenance program. On this table, I tried to jot it down exercises, different exercises like stretches. We start through do it every day, and it is started through the day one, goes up to 45 days. Aerobic conditioning, day one. Resistance exercises, day one. Yeah, cone and agility training after a week, it is added. Then jumping drills after 21 days. So it depends totally upon the rehab protocol. It has to be individually tailored for a particular astronaut using the FIT principle based on the assessment and what you have found out and what were their pre-flight levels. So all these data has to be matched before we formally release them, from the rehab program. So that was about a little bit or a glimpse about space physiology and the space physiotherapy. To conclude this session, I would like to play the recording of this astronaut would like to say something, because I am an advocate of exercise. So according to me, if you want to stay healthy, stay in best shape, either on Earth or in space, exercises are the best way to keep yourself healthy. But let's see what this astronaut has to say.
One thing to remember is you want to enter your space flight as very safe as possible.
Voice is not clear.
Yeah, sorry for the quality of the voice. So he meant to say that if you want to stay healthy and enter the space in a healthy way, exercises are the best way to do that. And that's what even evidence says. If you look into researches, it is gaining more and more advantage, as well as more and more evidences regarding the role of physiotherapy and the role of exercises to maintain astronaut health pre-flight, in-flight, and post-flight, that directly has an impact on space mission, or I would say on the success of a space mission. So with that, thank you so much for your time and attention. It has been an honor to provide an overview of this important topic. As we look to the future of space exploration, I encourage that you stay engaged with the latest research and advancement in this field, because India has also announced human spaceflight program Gaganyaan, and they are doing all those testings. And I believe for the successful Gaganyaan mission, physiotherapist would be an integral part of the medical crew who would be looking after the crew's health and performance. Thank you so much.
Thank you so much, ma'am, for your insightful session and engaging session. I would like to ask you questions regarding the space physiotherapy.
Sure, ma'am.
I've got few questions, if you don't mind. What are the most common musculoskeletal or the neurological condition do you face in a space, on the space mission?
So like we said, there is a bone loss, there is muscle loss. Yeah, there are injuries. So depending upon if an astronaut has gone for a spacewalk or not, type of injuries differs. Low back pain is very common in astronauts. If someone has gone for, say, an EVA, that is the spacewalk, upper limb injuries are very common. So it totally depends, what task has been given
Okay.
to a particular astronaut and how long the astronaut is going to stay. So it totally depends on that.
And how difficult is to treat like the neurological condition in the, space?
So do you
The
mean
space,
once
if the person is,
astronauts come back?
no, in the space itself?
So like I said, the changes what we have seen, it is favorable for the microgravity environment, right?
Right.
It is unfavorable for the Earth's environment, and that's where rehab is needed. So what we do is, so all these systems, like I've said, they are using different equipments to maintain different targeting different systems. When you specifically talk about vestibular system, because that is not acting, so we use
Right.
VR for that. So we are using
Okay.
VR in space. Yes, they use VR in space, but once they come back, the vestibular rehab, we give them the time of 1 to 2 days. So what happens is, as soon as the astronauts enter the Earth's gravity and try to move their head, their vestibular system starts acting, because now the gravity is there. So if you can check on YouTube videos or on Google, once the astronauts come, they fix their head, although they sit and stand, they rarely move their or tilt their head, just because of this reason. Because if they immediately start moving the head, they're going to have a very, very bad input. And like I had a chance to discuss this with former NASA astronaut, Professor Jeff. That was his first flight. He came down, and after so long he saw Earth, and he started to moving his head, and he suddenly felt that bang in his head. And then he realized that, no, I do not have to, because it was so unusual that he hasn't felt in the space. But after that first flight incidents, remaining of his 4 flights, one thing what he remembered after landing was not to move his head more, because he knew what his body is going to experience.
Yes.
So, but if you see, it's like 1 and 2 days, they are okay. The vestibular system starts, and the brain also starts readapting to Earth's gravity. And that's where, exercises, the vestibular rehab exercises takes place.
What is like more important? The neuro rehabilitation is more important, or the muscle strength training is the more important?
It depends upon the it depends upon the duration of the flight. If it is a short duration flight, like muscle and bone loss won't be evident. So it takes around 4 weeks for us to have that measurable bone loss. When I say 1.5 to 2% of loss, that is measurable. That is after 4 weeks. So if somebody is way less than that 4 weeks window, it would be the balance and coordination and vision and your cardiovascular. That is more what we'd be targeting on. And that's why you can see Mr. Shubhanshu Shukla, when he came, he could stand better than Sunita Williams.
Hmm.
Yeah.
So Will there be any side effects like after coming from the spacecraft onto the Earth? Vestibulitis is going to affect afterwards as well, or that is for the particular time period it is going to affect?
Particular time period. It just because it is not being stimulated in the absence of gravity, and once they are back, it is there. So we give time for every system to adjust to 1G environment of Earth, and that's
In that
where
way, like
all the
simulators are.
testing.
In that
Sorry,
way,
ma'am.
simulators are very important to get adjusted into the environment back.
Yes, and that's what their training is also such, because this was just an overview. I could not, show how they are training in the pool for say 6 to 8 hours a day. And then even after coming back, like I said, pool versus gym time, we have to, match it according to their convenience. And it's like we say, it's like 1 to 2 days we give them for adaptations, but there could be other significant changes, male versus females, short duration versus long duration. There are other factors also to be considered.
Yes, it shows that exercises are important not only on the Earth, in the space as well.
Exactly, and that's what I always say.
Thank you so much. Thanks all the participants for joining us today. And I really would like to express my sincere gratitude to Dr. Garima, who took her time, who took her precious time, and share her knowledge and insightful session. And hello, Nidhi ma'am. So
Yeah,
I really
hello, Vidhu ma'am. Thank you, Dr. Garima. I mean, it was very insightful. I just want to understand one thing, if you allow, Dr. Vidhu. I'm sorry, I'm interrupting in between. I mean,
sorry.
usually, what do you think that how much time an astronaut takes to come back to the normal life after the mission?
Ma'am, like I said, if it is a short duration mission, it would be few weeks, 2 to 3 weeks. And if it is a long
Okay,
duration, we say it 45 days, but it could be plus and minus as well.
okay. And we are
So
able to get them absolutely normal. This is what you want to say, like, the
um,
bone, the
we
muscle,
take them
neuromuscular.
back. We take them back to their pre-flight level of physical fitness. That's what I would say, to be very precise. And that's where I
Hmm.
also mentioned about the maintenance program, that they have to continue doing those exercises which are being prescribed.
And are they able to adjust with the exercises in the space?
Yes, ma'am. And that's where the pre-flight training with the replica, we train them. There are, underwater gyms as well. So they get an insight how it would be feeling. Um, you have heard about the NTG treadmill on Earth. So that was one of
Right,
the technology which was from space. We have got it from for our patient population on Earth, and that is also used for the astronauts. So they get the feeling how they would be exercising in space.
right. Thanks a ton. I mean, it was a great, insightful session. Vidhu, I
Thank you.
won't take your vote of thanks, so please continue.
I really would like to express my sincere gratitude towards our speaker, Dr. Garima. And thank you so much, ma'am, for your insightful and the engaging session today. We truly appreciate the time and effort you put into this session and sharing your knowledge with us. I would really like to extend my thanks towards our IAP President, Dr. Sanjeev Jha sir, our National Head IUPWC, Dr. Ruchi Vaishne ma'am, for their continuous support and help. Dr. Nidhi Kalra ma'am and Dr. Neeti Khurana for arranging this insightful and a very knowledgeable session on the National Space Day. Uh, Thank you so much, everyone, and thank you IAP India YouTube channel, who is giving such a good platform for us to arrange these webinars. And thank you so much, ma'am, again. Thank you, Uttara ma'am.
Thank you so much for having me. Thank you so much.
Thank you so much. It's really lovely to see you here and to take this session with you on this our National Space Day. This is the, I think, second National Space Day we are celebrating this year.
Yes, ma'am. This is the second National Space Day, and AstroScience has launched AstroScience Junior program, which was a huge success, just to let you know. So thousands of children actually participated in space-inspired exercises from schools, and which included, children who were having special needs as well.
Yeah, and we would really like to arrange one more session with you, ma'am, to get into more space physiotherapy.
Sure, ma'am. I would
See
be
more.
more than happy. I would be more than happy to do that, ma'am. And
Ma'am,
just
you
for
are
the
not audible.
participants.
We would
Am I
also
not?
like to have you sometime in person also in India, maybe training the people here.
Ma'am, yes, ma'am. Actually, AstroScience is making 7-day training program. So it is in pipeline, not yet been confirmed. But AstroScience regularly conducts webinars and workshops online. Giving them because this was on YouTube where participants would not be engaging in person like that. So we do conduct webinars. If anybody is interested, they can just log on to our website, astroscience.org, and contact us via the contact us page. And we would try our best to, get back to them. So it just through, your platform, it's so wide and it's so helpful for the students basically to learn about this new topic. So I'm so thankful to you, ma'am.
Thank you so much. We would also like to get trained with you people.
Thank you so much. Yeah. Ma'am, are there any further questions?
No.
Ma'am, yes, one question is there. Like, how about managing orthostatic intolerance?
Yes. So along with physio, depending upon which space agency the astronaut has flown with, the protocol differs. So there are two different protocol. There are two modules on International Space Station as of now. One is the NASA module and another one is the Russian module. What exercise equipments I have talked about today was for the NASA modules and not for the Russian modules, although similar equipments are available. Coming to orthostatic intolerance, so there would be changes in the diet, fluid intake, there would be changes in the exercises that would be done. The assessment, the parameters would be taken prior to landing. So then we know once you are here what to expect. And that's where the support crew is always available, once the astronaut lands. Now, if somebody is having as soon as the astronauts lands, all the parameters, you can see the pulse oximeter, blood pressure, everything starts, they start to measure with. If needed, we start with the tilt table for them, how we do for our patients. So it totally depends, on an individual person. Tilt table would be one example to manage the orthostatic intolerance. Another one would be something called as different suits that are been designed, compression suits. So they wear it so that in flight before landing, there's some duration and prescription is done for that. So what happens with those compression suits is they starts to pump blood more from the lower limbs towards the heart. So there are different strategies which has been done depending upon, again, which space agency and what protocol a particular agency follows. Thank you.
Thank you, ma'am. I think there is no other questions left. So it was really a nice introduction towards the space physiotherapies. Whenever you feel like taking the webinar, please let us know. We can
Sure,
we would really interested to join you again on our IFP India channel.
Yeah. Thank you so much, and I wish you all a very happy National Space Day once again. Thank you.
Thank you so much, ma'am. Wish you the same National Space Day. Thank you.
Thank you.